So what are some of these key non-clinical factors and how do you address them as you work to improve Black maternal health in communities?
Thank you. Thank you. So, like you mentioned, really my role and my team really focuses on working with the community organizations and people to address these non-clinical drivers of the Black maternal health crisis. And really as it relates to like the weathering effect, that chronic stress that Black women have. I mean, we carry it before we even, conception, right? And also the impact of racism, and these factors build up over time and lead to these adverse health outcomes. And so honestly, as a Black woman also, and based on the literature, we know things like a higher income or educational attainment, it does not necessarily shield us, or they're not protective factors when it comes to these maternal health risks. So rich, again, is rooted in systemic inequity. And so we also look closely at social determinants of health. I know, Dr. Jackson, you mentioned that transportation, how long does it take a patient to actually truly access care? We look at things like housing, food access, and whether a mama is receiving culturally competent care as they deserve. And so it's also important for us to talk about implicit bias of providers, some providers, the institutional barriers that we mentioned, like maybe with insurance. We talked about if there's a language barrier, things of that sort that can prevent someone from having respectful, responsive care. And also, in addition to the physicians, we also focus on having access to birth workers, whether that's a community health worker, a doula, who are very vital to supporting that mama, during birth, pregnancy, and postpartum.